Welcome to Winchester in the Know. I'm your host, Sergeant Dan Perenick of the Winchester Police Department. I'm your school resource officer and work closely to keep youth, adults, seniors safe within our community each and every day. I'm also the police department's liaison to the Winchester Coalition for a Safer Community, and in partnership with WinCam, we will bring you a topic on each show that you should know about. Through sharing information with our community, we hope to prevent issues and problems that we are seeing and dealing with often. We also hope that our parents use this information to assist them while parenting their children at all ages and save them hardships others have experienced in the past. We know all are very busy, but please take some time to view this short program and let us know your thoughts. This show's topic is how the health department can service the town of Winchester, and we are joined by Jennifer Murphy, Director of Public Health for the town of Winchester. Jennifer, welcome.
Thank you.
Nice to have you with us.
Thank you.
We're going to spend just a few minutes talking a little bit about your department. And there's a number of things that we've worked together on, one being the Coalition for a Safer Community. But why don't you take us through your role as director, how long you've been the director for, and some of the things that you guys do.
Sure. So I've been with the health department for 15 years now. And basically our job is to protect and promote the health of the community. And we do that through a variety of different ways. We want to protect the public from environmental health hazards. We want to protect them from communicable diseases. And we do that through health education. We do it through environmental mitigation strategies. And we do it through permitting. So there's a variety of different ways we approach this, but the overall goal is to ensure the health and the well-being of the community.
And there's a board of health. Can you explain about your role and how the Board of Health, the members that work on the Board of Health, how that all works together?
Right. So I report to a 3-member board, and they're elected. And they're essentially my collective boss. And so my day-to-day activities are really within the health department are myself and a few staff that I have within the office. And we carry out the day-to-day activities. But in the end, when it comes to voting and approving, let's say, regulations around public health, that would be the board that would take that official position and make that vote. So I report to them about what we do and what emerging issues around public health are coming out in the community. And so I keep them up to date of what's going on. And then they take the official formal action to regulate something in the town.
Can you tell us about the folks that are within your office? Who works with you and for you in the office?
Yeah, sure. So we have a fairly small staff. It's myself, and it's a public health nurse, Kathy Whitaker. She's been with the health department for 22 years. And we have, let's see, Dot Butler, who's the community health program manager, and the Winchester Coalition falls under Dot Butler. We also have a part-time animal inspector run out of the police department, as you know, Jerry Smith. He's been there for quite a while, just retired, but still helping us out. So we have a few people, and of course we have an administrative assistant who's probably one of the more important people. She's the face of the health department when you walk in. She's the one answering the phones, so she has a vital role to play as well.
And in the department, we'll give information towards the end of how you can contact the Board of Health. Any questions, any concerns that you have, it's a great staff, and they're here to help and keep the community safe. So transitioning over to the Winchester Coalition for a Safer Community falls under your office, and the project manager, Dot Butler, is a huge asset to the town, along with all the stakeholders and partners that we have in the coalition. And it's made up of members of the Board of Health, it's made up of the police department, the fire department, Winchester Hospital, the schools, our parents' organizations. I mean, I can go on and on with a number of groups that come and meet monthly in the Board of Health, in the town hall across from the Board of Health.
Right.
We meet the second Thursday of the month, and it's a wonderful group. We also partner with the Mystic Valley Public Health Coalition based out of Medford that services our community, and they're a great resource also.
Yeah.
Can you talk a little bit about the work with our coalition and maybe the Mystic Valley Public Health, how important it is to have a team like this to support what you do?
Oh, it's vitally important. Dot Butler, as you said, does spearhead the coalition, and she really does a lot of work to keep ahead of the emerging trends around risky behaviors, especially among our youth in the community. And she's really responsible for bringing speakers and experts on topics around risky behaviors that we see, for example, drug and alcohol use in our community. And that's really the core mission of the coalition. However, we have sort of branched out into other areas and topics like mental health, areas of concern among the community at large. And so it's incredibly important to get many people at the table from all different aspects of the community. For example, parents have a role in helping protect their kids, but they themselves also need to be educated about what's going on and ways to keep themselves healthy as well. We also look to the community organizations to help us out. Winchester Hospital plays a big role, for example. So there are many different partners that we have, and it really wouldn't be possible without them all at the table. And so the Mystic Valley Coalition is really a regional collaboration, and their focus is on alcohol use, marijuana use, and really the prevention strategies coming out of there benefit us directly, actually. So we're fortunate to be joined into that grant-funded collaborative because they promote and protect really our youth as well. They come up with some great reduction strategies, some great health education materials, tips for parents on how to stay abreast of what your kids are doing and how to keep them safe. So really, it's an approach from many different angles and many different perspectives. So yeah, it seems to be working well, but it's always a work in progress because you never know what's going to sort of be around the corner.
Yes.
As you know, in your day-to-day role,
Sure.
right? So that's why this collaborative effort is so important.
And I think you hit the nail on the head, education for our adults, our parents, our kids, members within our town departments. We just did a program last year, and we were able to educate a number of town employees on employee assistance, on insurance, on supports and resources that are out there, also similar to what we do with the coalition, so that our town employees have that information. I think that was a great program, as much as our kids and our senior citizens too. I think that we do touch that whole gamut, and the Department of Health does that.
Right,
across the whole gamut.
exactly.
You know, we talk a lot of times through the coalition, we talk about the 4 E's, education being the first one. The next one being encouragement and supporting the community and doing programs and being there as resources. And then the elimination piece, you and I have worked closely on the medication take-back program, along with the Hazardous Waste Collection Day. We've partnered together spring and fall, where you run the Hazardous Waste Collection Day. Maybe we can talk about that a little bit. And we at the coalition side, and my role is to work with DOT on collecting all the medications. Also through a grant through the Board of Health, we were fortunate enough to get a Sharps recycle kiosk at the police department, and the public safety open 24 hours a day to bring used needles in containers, Sharps containers or hard-sided containers to be put in there, and they get recycled. So can we talk a little bit about hazardous waste, medication take-back, and the needle program?
Yeah, sure. And I'm glad you brought up the kiosks, because the Sharps collection kiosk is located in the police station, 24/7 access for people who want to return needles in their containers. And it sits right next to the medication kiosk. So both of those are available 24/7 to the public, correct?
That's correct.
Yeah,
yep.
and we were able to obtain the needle kiosk through a grant from the state. So we were fortunate enough to get those in place. So that was good. And then the medication take-back day itself is coming up April 29th.
27th, I believe, this year.
Excuse
Yep.
me. April 27th, Saturday.
Yep.
And that will be located right outside of the transfer station, correct?
Yes, yep.
Yes. And then the following week on May 4th, Saturday, is the Hazardous Waste Collection Day. So that's the day where, you clean out your garage, you clean out your basement of old paints, of old pool chemicals, mercury items, things that you don't want in the regular trash waste stream. So things that we don't want to see at the transfer station, you bring to Hazardous Waste Day, and we'll be happy to take them free of charge to the residents. So, and Medication Collection Day is free of charge to residents as well. So it's 2 huge events that we run twice a year for the community.
The Hazardous Waste Day is held at what location?
Oh, sorry, it's at the DPW on Lake Street.
And usually runs for several hours. And do they need a license or anything to show their residency there, or is it? Just
Yeah.
proof of residency to drop off those items?
Yeah, so we would like people to remember to bring their ID. However, if you have a sticker for the transfer station, we know you're a resident and that'll get you in.
Oh, that's great.
But just bring your ID just in case, and it is, again, free of charge. So.
Terrific. And the medication take-back program that we've been doing spring and fall, partnering with the department, with the Drug Enforcement Administration, the Police Department, the Coalition, and having these 2 kiosks over the last 8 years, we've taken back over 6,000 pounds of unused, expired, not wanted medications, both prescription and non-prescription. So it's been a great success, and that's part of that elimination piece of what we talked about, the 4 E's: education, encouragement, support, resources, elimination, and then the last one is enforcement. And in the police department, we have our enforcement to do. Can you talk a little bit about enforcement of the Board of Health? Are there things that you have to do sometimes?
Yeah, sure. So oftentimes my first approach is to try to get buy-in from folks to do the right thing, to make changes they need. Let's say if someone owns a piece of property and it's perhaps a bit of a mess. And so, I have a dialogue with someone, and if that doesn't work, then yes, I do have to take enforcement measures. And essentially that means writing a letter with a timeline for correction for people. And of course, I have the ability to take action in court, which I prefer not to do.
Right.
So, but again, it's the enforcement piece of my job, so that if you don't do the right thing, let's say as a homeowner or a restaurant owner or someone that I permit, then I do have the ability to take that action, because we do want to see people living up to a certain standard. There are codes in our state, a housing code, a food code, and other codes that people have to comply with. And so if you don't, then yes, I do have the ability to take that action.
And it's all about public safety and public health and maintaining a healthy community.
Exactly.
And I know that you've worked with both police and fire departments and working with people in town and speaking to them, working with them, writing letters, and then the last thing, and very seldom do we take them to court, but
Exactly.
it might have to do that.
Right. It is rare, but it is good to let people know that tool is in the toolbox in case we have to.
How about our public health nurse? Can you talk a little bit about what her role is and what
Sure.
you offer and she offers through the department?
Yeah, so Kathy Whittaker has been really a big asset, I would say, to the town, because she has done a fabulous job really expanding the scope of the vaccinations that we offer. For example, our flu clinics. They have grown in size over the years that she has been there. And she's come up with novel ways to really get more people vaccinated. For example, offering vaccines in the schools during the school day to students. It's a very convenient way for parents to ensure that their child is protected through a vaccination like the flu vaccine. We offer that every year at the schools, and it's a very easy system. Parents can sign up electronically. So we have great enrollment in that program. And we've offered new programs over the course of the year. For example, a year or two ago, we offered the HPV vaccine
Great.
for high schoolers and middle
Before they go
schoolers.
off to college?
Yes, exactly,
Yep.
exactly. So she's come up with new ways to get people vaccinated. We also have the shingles shot.
I was going to say, yep.
It's in high demand, and it's a great vaccine to get. There's a new one out, and it's a 2-dose series, and we are offering that to the public. We don't have a large supply right now, but we hope to purchase more and more as it becomes available. We do have some now, so if people want to contact my office, we can certainly try to make an appointment for a resident.
No, that's great. A lot of resources, a lot of programs that you offer through the board, and we think it's very important. The Coalition for a Safer Community, since 1999, we started the program way back with Chief Peritano and Randy Schwartz from the Board of Health.
Yes.
It partnered together. We've had some great directors and some great folks along the way. We just keep working, and as you indicated, new things are just around the corner. Right now we're dealing with the vaping and the juuling and different
Right.
types of e-cigarettes, and we're going to be doing a series on that shortly. So right now that's kind of big. Our marijuana, legalization of marijuana, we're working on programs of that type for education and enforcement. Is there anything else that the coalition that stands out that we've been working together on? Does anything stand out that...
I would just say how we've branched out into really addressing the issues of concern around mental health. I think that's incredibly important.
Yes.
I think the data in the Youth Risk Behavior Survey has told us it's important that students and parents need help.
Yep.
And so we would like to try to offer those support services for them, and the schools do a fabulous job doing that, but if we can complement our efforts together, then that's all the better for the community.
Very much, and the statistics are big right now around it, and as you indicate, the school does a great job. Pediatricians and private care physicians, but also working with us in the coalition and the Board of Health, we can get resources for folks if they need it, not to be afraid to reach out to us. Awesome having you in today.
Thank you.
I really appreciate you spending time with us and sharing some of the programs that you do. I wish to thank our guest today, Jennifer Murphy, for sharing this important information. Please let others know in the community about this program and encourage them to view on demand at wincam.org. If you would like more information about this program or any others within the series, please contact the Health Department at 781-721-7121 or Jen Murphy at winchester.us. Lastly, we encourage you to download our Winchester Coalition app, 01890, which also contains our text tip line. On behalf of the Winchester Coalition for a Safer Community and WinCam, I thank you for taking this time to join us at Winchester in the Know.